Dear all, today we are going to discuss about treatment of congestive heart failure. Heart failure is due ventricular abnormality results in inability of ventricle to eject or fill with blood. There are two types of HEAR failure, systolic and diastolic heart failure. CHF may normalized by altering RAS pathway, sympathetic nervous system and ventricular hypertrophy. This slide explains how the reduced cardiac output can be reversed with the help of drugs, highlighted in red. Heart failure can be treated with help for inotropics, beta blockers, ACE inhibitors, AR blockers, aldosterone antagonist and diuretics. Classification of CHF treatment. The low cardiac output can be relieved with help inotropics, diuretics, vasodilators, ACE inhibitors and beta blockers. The survival and arrest of heart failure progression can be done by ACE inhibitors, beta blockers and aldosterone antagonist. Cardiac glycosides are inotropic drugs, cardiotonic drugs, digoxin, digitoxin, increase myocardial contractility and output in a hypodynamic heart without a proportionate increase in oxygen consumption, do not increase the heart rate, have prolonged actions, thus the efficiency of failing heart is increased. The pharmacologic resides in aglycan, but attached sugars modify solubility and cell permeability. In general, aglycanese have less potent and short-living action. Aglycan is consist of CPP steroid ring to which is attached 5 or 6-membered unsaturated lactone ring. Cardiac glycosides inhibit the enzyme NA-kATPase, also called sodium pump, present on the cardiac myocytes. This results in increased intracellular Na and calcium. Thus more calcium is available for contraction, resulting in increased velocity and force of contraction. Inhibition of sodium pump increases Na. This prevents calcium extrusion and also drives more calcium into cell during depolarization through voltage-sensitive calcium channels. Decrease heart rate due to increased vagal tone, decreased sympathetic overactivity due improved circulation by direct action on SA and AV nodes. Systole is shortened. Diastole is prolonged ventricles more completely emptied due to forceful contractions. Digitoxin is most lipid-soluble and digoxin is relatively polar. Bioavailability of digoxin tablets from different manufacturer differs, so stick to one preparation. Presence of food in stomach delays the absorption of both large volume of distribution 6 to 8 L per kilogram, all a conc in heart greater than 20 times than in plasma. Digitoxin is primarily metabolized in liver partly to digoxin and undergoes some enterohepato-C circulation. Cumulative drugs. Digoxin is used in congestive heart failure cardiac arrhythmias. GIT adverse events are due to gastric irritation, mesenteric vasoconstriction and stimulation of the CTZ extracardiac, gastrointestinal, anorexia, nausea, vomiting and diarrhea, abdominal pain, neurotoxicity, vertigo, blurred vision, disturbances of colored vision, headache, confusion, neuralgia, disorientation, delirium, hallucinations and rarely convulsions. Others, allergic skin rashes, gynecomastia. Toxicity of digoxin is reversed by digoxin antibodies, Fab fragments, Digibind, which is extremely effective and should always be used if other therapies appear to be failing. Amrinone and milrinone are selective phosphodiesterase 3 inhibitors, used in short-term treatment of severe heart failure. Mechanism of inodilator. Milrinone inhibit phosphodiesterase 3 results in increased cardiac output, deceases the preload and afterload, which leads to inodilation. Loop diuretics. Furosemide, butemonide for fluid control, and to help relieve symptoms. Potassium-sparing diuretics. Spironolactone help enhance diuresis, improve survival in CHF. ACE inhibitor improves survival in patients with all severities of heart failure. Drugs are enalapril, captopril. Above is dosage regimen. ACE inhibitors act by reduction of afterload. Angiotensin E is a powerful vasoconstrictor present in the plasma in high concentrations in cardiac failure. ACE inhibitors prevent the conversion of angiotensin I to angiotensin II and thereby reduce the afterload reduction of preload. Aldosterone causes retention of salt and water and increases the plasma volume. Preload. ACE inhibitor prevent formation of aldosterone and thus decrease the preload. Reversing the compensatory changes. Angiotensin II responsible for cardiac hypertrophy and remodeling. ACE inhibitors reverse these changes. IV sodium nitroprusside and nitroglycerine are used for severe heart failure. Beta blockers, carvedilol, metoprolol, bisoprolol, can improve overall and event-free survival in NYHA class 2 to 3 HF, probably in class 4. Meds to avoid in heart failure are NSAIDs, thiazolidinidiones, metformin. This slide represents the clinical usage of drugs in various stages of heart failure. Thank you all for your patient listening.